Hi, Dr. Eric Lund here, your local neck and back pain specialist. And the topic in this video for you is related to concussions. So there was recently a fairly big study that shed some important information related to concussion prevention and also concussion treatment. And so one of the things that we're noticing when they look at the data is that it seems that women and girls are more prone or higher or suffer concussions at a higher rate compared to boys or men. And actually, women's soccer is the second highest sport rated for concussions next to football. And what this study looked at is there seems to be a major connection between the strength of the neck muscles and your risk of concussion. And so what they determined is that if you're someone that has a smaller or a weaker neck, you have a much greater risk of suffering a concussion. And the reason why they think that girls and women are more susceptible to concussions is that in general their musculature is going to be less than a male's musculature. So if they're subjected to the same force, because in many cases their neck may not be as strong, they're more likely to suffer concussions. So that's number one is it appears that the neck and the strength of the neck plays a major role in your risk for concussions. And what they also did in this study is then they looked at the strength of neck muscles, and they determined for every 1 pound of increased strength you can gain in your neck, it reduces your chances of a concussion by 5%. So again, if you increase your neck strength by 5 pounds, you have a 25% reduction in the chance of a concussion. Now, if you've already suffered a concussion, this also sheds light on some important aspects of treatment to help you improve your concussion symptoms, especially if you have neck pain or headaches or lightheadedness and other symptoms such as those. Is that you need to start having treatments that address the structures of the neck and the muscles of the neck. And that's where spinal manipulation would come in. Several patients that I've worked with that have had concussion-related symptoms, when we do treatment to the neck, it does oftentimes help lightheadedness and headaches and such symptoms as those related to concussion. So I think another takeaway from this is that you want to have treatment to the neck. Spinal manipulation positively affects the muscles of the neck, and then we also want to focus on strengthening the neck muscles. So again, if you have experienced a concussion, have symptoms, a big key may be having some treatment to the neck and strengthening the neck, and certainly focusing on those things if you're looking to also prevent concussions. Thanks for watching, and we'll see you next time.